So hello, and thank you for joining us for this webinar on smoking and providing information on that. And today we have two special guests. So we have Dr. Rebecca Dunsmore-Sue, our Chief Medical Officer here at Genève, and Dr. Ann Lipke. I hope I'm pronouncing that right, so you can correct
Sure.
me if I'm wrong. They're both going to introduce themselves and their backgrounds. First, I'm going to introduce myself. I'm Stacy Kazinchuk. I'm a registered dietitian, nutritionist, exercise physiologist, and the director of health coaching here at Genève. And today's topic does span all different areas of health. And in honor of National World Non-Smoking Day coming up here at the end of the month on May 31st, we wanted to discuss this topic and specifically how it relates to menopause. So Rebecca, I'd like you to introduce yourself and with our audience and let us know your role here at Genève.
Okay, great. Thanks, Stacy. I'm Rebecca Dunsmore-Sue. I'm Chief Medical Officer here at Genève, and I am also a practicing OBGYN in Seattle, Washington, and a menopause specialist. And my job at Genève is to sort of provide the medical background on everything and work on content and do telehealth and run those programs and work with Stacy on these webinars.
And Dr. Lipke, please introduce yourself to our audience.
Sure. My name is Ann Lipke. I am a practicing pulmonary and critical care doctor in Seattle, Washington. I oversee one of the ICU campuses, or one of the ICUs for our campuses at the Swedish health system, and have a busy outpatient practice of pulmonary medicine.
Well, thank you both also as physicians right now being frontline workers and the work that you're doing. And I know Dr. Dunsmore-Sue's in her office currently, so we're working and seeing patients. And Dr. Lipke, are you seeing patients right now as well?
Yeah, I just came out of the ICU. So when the pandemic started, I actually stopped seeing patients in the clinic and got pulled to only ICU coverage for a couple of months. And some of my partners helped take care of my practice panel in my absence. And so now I'm back to work, but we're doing some like remote work. So some days I work from home like this.
Okay, excellent. Well, thank you for the work you're doing. And while COVID-19 can have respiratory effects on people, we are going to talk about a different respiratory effect today in terms of smoking. And Dr. Lipke, could you give us an overview on what happens to the body when you smoke, and maybe even from a standpoint of like someone tries a cigarette for the first time, what happens to 5 years, 10 years down the line?
Well, people's sensitivity to smoking in terms of like lung health is actually pretty variable. So it's unpredictable as to whether people are going to have, like, for example, COPD, et cetera. But we know that tobacco smoke, and other types of smoke actually have quite a bit of carbon monoxide in them. So there's some amount of carbon monoxide poisoning, a very small amount that happens as you smoke. And it's full of a number of different chemicals that are vasoactive, meaning that they change the blood pressure and the heart rate, so increase both. And can be used, I mean, it's very neurologically active, right? So it's profoundly addictive, but can be calming, it can be stimulating, et cetera. So there's a lot of different ways that people can become addicted to it because of those different impacts. Long-term, all of the burned products are carcinogens, and those carcinogens go to basically every organ system, but particularly to the places that are exposed to smoke. So the lips, mouth, throat, lungs, and then actually excreted in the bladder. So we do see more bladder cancer in smokers.
Oh,
and then of course, the impact on the heart rate, vasoactive, like vasoconstriction, and increased blood pressure, increase the risk of heart disease.
Yeah, a lot of impacts. Whole body sounds like for sure.
Whole body impacts, yeah.
Absolutely. In fact, from an OBGYN perspective, we also see a higher rate of cervical cancer.
Oh,
Although
wow.
cervical cancer is considered a human papillomavirus disease, if you're a smoker, you're at increased risk for that viral disease turning into cancer.
Huh. Do we know from a research standpoint why that may be?
It probably has to do with immune modulating effects. And, like Dr. Lipke said, it's a carcinogen. It's a carcinogen everywhere in your body. And it gets to every part of your body. So
interesting. Well, that brings me to another question. How about when we're comparing men versus women? So, Dr. Lipke, is there a difference in how smoking affects female versus male?
Not that I'm aware of actually. And there may be some data on it that I'm not aware about, but it's interesting, and we'll probably talk about this later. But there are some impacts in terms of with regard to gender on the ability to quit or the perceived ability to quit, and the ways that we can support men versus women in quitting. Women, particularly as they get older, are probably not as addicted to the nicotine component as they are to the behavioral component of smoking. Which is really interesting. So their amount of nicotine dependence in general is lower, but the behavioral aspects of smoking, the social nature of it, and the habitual nature of it is a little bit stronger. And so we do see some differences in the ability to quit.
Oh, that's interesting. Yeah, let's definitely come back to that when we talk about strategies around quitting smoking. But let's continue on the female side of things. And Dr. Dunsmore-Sue, how about during menopause and smoking? What do you see in that area and the effects on women going through this time of their life?
Absolutely. So the one thing we know from studies is that women who smoked for a long time, and that's not well defined exactly how long that needs to be, tend to go through menopause just a little bit earlier, on average about a year earlier than women who don't smoke. The other things that I think about as a provider for women in menopause are the impacts of smoking on bone disease and heart disease, because both of those rise quickly as a woman goes through menopause, so you're much more at risk for osteoporosis and fractures related to that. And smoking women are at even higher risk. And then the cardiovascular changes that happen with menopause are exacerbated by smoking. The other thing that women often ask me, and that we see in some studies, are that the symptoms of menopause are exacerbated by smoking. So women who smoke tend to have a higher rate of hot flashes, sleep disturbances, mood disturbances, and anxiety as they go through menopause. And smoking has a bad impact on hair, nails, skin, things like that.
Oh, that's interesting. And you mentioned that they tend to go into menopause earlier. Is that a bad thing for a woman to start menopause earlier, or are there negative consequences to that, or do they then go through menopause faster if they do that?
You don't go through any faster. You get all the years of menopause, or all the years of symptoms at least. You just
Yeah.
started a year on average earlier than other women. The only really worrisome thing about going through menopause earlier is that that's just one more year of your life where you're going to spend at risk for bone and or cardiovascular disease. And especially if you're a smoker, that's a higher risk.
Oh, that's interesting. Yeah, that's a good thing for women to be thinking about if you are a smoker and in menopause already or getting closer to that age. It could be a great time to think about quitting. So, what about if you're trying to quit during menopause? Is that something, can that be more challenging? Is there, what do you see in your practice if you have a patient that is in menopause and trying to quit?
So the two things we most commonly hear about perimenopausal or menopausal women who are trying to quit smoking are that they can get a temporary upswing in hot flashes, and a lot of that, and a temporary upswing in anxiety, and a lot of that happens around the menopausal transition anyway, but adding the quitting of smoking, which can for some people be calming, can exacerbate that. The other thing that most commonly comes up is that everybody knows that people who quit smoking tend to have, on average, some weight gain. And women who are going through menopause, on average, have some weight gain. And so there's a lot of worry about those two things coming together to add a lot more pounds. In general, we don't see that. You're not at a higher risk of gaining more weight if you quit smoking around the time of menopause.
Okay. Yeah. Interesting. Well, let's come back to the COVID-19 piece too. Dr. Lipke, right now, with this pandemic that we have, what are we seeing in terms of individuals who are smokers? I've heard that they're at an increased risk. I don't know. I'd love you to speak to that and what effects they might have.
Yeah, data's all early still in COVID-19, right? Because we've only been studying this for 6 months or so now as a community. But the early studies are suggesting that smokers and even active smokers and former smokers to some extent are more likely to have more severe disease. So they're more likely to be in the ICU. They're more likely to require mechanical ventilatory support. So, either a mask to provide sort of, artificial big breaths to support breathing, or a sedation and a tube requiring requiring mechanical support, so artificial breathing. And both of those are predictors of worse outcomes, of course. So if you have mild disease and don't end up in the hospital, you're much more likely to do well than you would be if you ended up in the ICU on a breathing machine. The reports are really variable about the survival out of the ICU. We've seen in some circumstances, like for example in Seattle, survival out of the ICU is more than 50%. But in some of the studies that have been published, for example, out of China and Italy, and earlier studies in New York, the survival out of the ICU is actually quite small.
Okay.
So good to avoid it if we can.
Yeah.
And if there's a modifiable risk factor, it's obviously great to minimize that if you can.
Yeah, absolutely. And then, Dr. Dunsmore-Sue, with menopause, if we add that into with COVID-19 and smoking, what concerns would you have for a patient in that situation?
So I'm not sure that menopause per se has a direct impact on COVID-19 and outcomes related to that, but as women age, obviously they rise into a higher risk category. So any risk factor that you can modify, obviously you can't de-age, but you can quit smoking. And quitting smoking pretty much immediately has beneficial effects.
Okay. Well, that's going to be our next topic is going to be going to the quitting action of that. But before we do, I do want to touch a little bit on vaping. Dr. Lipke, what's your take on vaping and how that plays a role here, if that's something a woman in menopause is doing?
Yeah, well, so vaping, last summer we saw quite, and we probably didn't see more incidents of it. We were probably just better at identifying disease related to vaping. But vaping still carries risk of lung disease. It's different than, for example, the long-term exposure to smoke, or at least to our knowledge it is right now. The major differences are that, while we see prolonged sort of breakdown of the lungs, typically in response to smoking, we see more scarring in response to vaping. And it's interesting, I still hear a lot of people that vape that are telling me, well, at least I'm not smoking, and that's the way that I'm doing it. And so it's not my preferred method to quit smoking. And I know that that's been one of the assertions of the vaping advocates, is that it's a good replacement. But to be frank, it has risk to your lungs in significant ways that some of the other means of quitting smoking do not have. So it's not something I recommend.
Okay, thank you for clarifying that, because I have heard that as well, that using it as a step down approach, but may not have there's other ways.
There are other ways that are much safer.
Yeah. Well, let's start talking about different ways that women specifically can quit smoking, especially those that may be looking to do that now around this National Day of non-smoking. Dr. Lipke, what do you typically recommend for that?
Well, there's one thing I want to point out, and you may be getting to this, and I'm sorry to go off topic, but one of the things that I struggle with my patients is sometimes they come to me and are say, but I've already done all this damage to myself. What's the point now? Like, it's going to be terrible, and and there's a couple of really important things that people should know about quitting smoking. And one is that immediately when you quit smoking, you stop the progression of COPD. So and I wish I could draw it for you. I could draw it on a little, piddly piece of paper here, but basically, as we age, everybody gets some amount of obstructive lung disease, and I sort of conceive of that in a colloquial way, as everything gets a little bit saggier as we get older, and that's the major issue, right, about airways, is that they get less support and they are more inclined to collapse as we breathe out, and that's what obstruction is. So when we talk about chronic obstructive pulmonary disease, or COPD, that's what that is, largely. And so everybody gets some amount of that as we get older. When you smoke and you're susceptible to it, and again, we never know if we're going to be susceptible to it or not, but when you smoke and are susceptible to it, you age faster than the average person. And as soon as you stop smoking, you change your curve back to a normal aging. So you'll never quite get back to normal, but the earlier you can do it, the better. And whenever you do it is a good time to do it. So anytime you can do it, you can leave that curve. So I think that that's really important for people to know, because, it is a hard thing to quit smoking. And it takes the average person a lot of, sometimes a lot of tries to do it, but there's always benefit in it. And although we do see some lung symptoms increase for the first couple of weeks afterwards in terms of sputum production as your lungs recover their ciliary function. In the first, immediately you stop the progression of your COPD. In about 5 years, you've reduced your lung cancer risk, maybe by like about 40% is estimated in the most recent Framingham study. And then reduce your risk of heart attack, et cetera, and pancreatic cancers, et cetera. I forgot to mention pancreatic cancer earlier, but so it's important to try, and there's no point at which it's too late to try. So back to your question. Sorry about that.
I think that's good to point out. Yeah.
Yeah. I mean, I think because we all expect, and actually I used to be a smoker. And so I have quit smoking. It was really hard. I cried for like a week on the sofa when I did it. And, it's not fun, but it's important to one's health. And so you just choose to sort of do it and try not to do it often, right? You try to do it just once in your life and then get through it. But sometimes people have to do it twice or more than that. So the ways that are good in quitting smoking, there are basically pharmacologic therapy and then behavioral therapy. Probably what works best is a combination. And actually, for women, it looks like behavioral modification is really important, or behavioral intervention is really important to give support and health coaching, probably more so than for men on average. Because again, the nicotine portion, nicotine dependence portion scores tend to be lower with women, and the sort of habitual part of it is more difficult to break. So, the ways that people can do it, nicotine replacement is actually a really easy way to access without having to go to a doctor to try. It's probably smart to have somebody coaching you about the dose you should be using and the expectation about trying to wean that. But to be frank, if people feel like they can't wean from nicotine, their nicotine replacement probably doesn't have major long-term side effects, with the exception that there's some concern that about angiogenesis, or new blood vessels forming in the places that nicotine exists or is in high concentration. So potentially an increase in oral cancers, but compared to all the other cancers that we see from smoking, probably a net gain if you can't get off nicotine. And then of course there are medications that your doctor can provide in the form of, varenicline, which is Chantix, or bupropion. Those are the kind of two big ones. And both of those are very effective. Chantix has a great improvement in success, and worth trying, but with the assistance of your physician, primarily because there can be, some changes in mood that surround it that need to be observed for.
Yeah, and if someone was interested in accessing those, do they go to their primary care provider, or is that a specialist that they need to see?
No, it could be primary care, and they do that a lot, actually. There are some interesting studies, and it brought it up, Rebecca, about older smokers not being recommended to quit smoking as often, which is too bad. Like it's not discussed as often with older smokers, and I'm not sure if that's just because we as a medical community are sort of less likely to think that people will be successful, although people can be successful at any age at quitting smoking. But if your doctor doesn't bring it up to you, it's worth bringing up to your doctor. A lot of people feel anxious about it because they get sort of shamed about it. And that, I think, most of us, particularly, pulmonary doctors who see a lot of people who are smoking and struggling with it, we all know it's bad for us, right? Every smoker knows that they're not helping themselves with regard to their health, and they're there for support. So if you don't get good support from your primary care doctor, certainly you can go to a pulmonologist and get some support. There are lung cancer screening programs that participate also in not only looking for lung cancers, but also doing smoking cessation practice with a lot of cognitive behavioral therapy support for people. Yeah. And so those can be good resources as well.
Excellent. And Dr. Dunsmore-Sue, as far as the women in menopause, resource or strategies that you have found to be helpful if you've worked with this population for you, things that stand out?
So I think to follow on what Dr. Lipke is saying, I think for women trying to quit smoking, there really is a huge behavioral component to smoking.
Hmm.
Both just like a physical behavioral component, the oral fixation, the hand to mouth movements, but also like the social behavior. Oftentimes they're in a relationship where both partners are smokers and only one is trying to quit. There are a lot of factors that go into that. So I often very much recommend that cognitive behavioral piece. It really does help to make I think part of it is changing habits and changing the way you think about smoking, and part of it is actually just having that support piece, someone else who's cheering you on and says you can do this, let's do this together, we can come up with strategies. Every time something seems to put you back, we can find a new way to get around it, and I think those things help. Doesn't mean that the nicotine replacement isn't helpful for women, but I do agree that they're much more in need of the cognitive behavioral arm of that. And I've had success using smoking cessation programs for the lung cancer screening groups. I've had success using even online programs. There are lots of great online group therapy programs and things like that that people can join. And sort of there's some level of accountability and structured behavior change.
Excellent. Yeah, I would agree that when it comes to these behavior changes, it's complex, right? Behavior is there's a lot of factors involved. And if you can have that social support, whether it's a family member or a friend, that might be most helpful. But even working with one of our health coaches, that could be something from the accountability standpoint. We wouldn't have the expertise on the smoking cessation specifically, but if that's something you want to work on, we can help in holding you accountable to that process and how it's going. So it's a great thing.
Mhm.
I often hear the question around or fear around quitting smoking also because of fear of gaining weight. And then women in menopause are already often struggling with changes in their body during this time. So some women I've talked to, that's their reason to stay smoking because they think they're maintaining a healthy body weight. What are your thoughts on that, Dr. Lipke?
There is a little bit of weight gain that happens when people quit smoking, and that's it's probably because we replace one habit with another habit sometimes. So it's not an absolute, right? You don't have to gain weight when you quit smoking, but people sometimes do. Um, there is no amount of weight that you could maintain. There's not enough benefit from a lower weight
Mm-hmm.
that would offset the risk of smoking, right? I mean, I would much rather deal with somebody with 5 to 7 extra pounds
Mm-hmm.
than with smoking in their body with those exposures. So in terms of health benefit, the weight change is by far the preferred thing. But again, it's not necessary that you're going to gain weight, or it's not an absolute that you will gain weight. It is a risk that you can. And to some extent, that's how we quit, right? So, I mean, it depends on how you quit as to whether you're going to gain weight. If you're replacing smoking with snacking, then obviously that will turn into a change in your weight. But there are not major metabolic changes, for example, that force it to be an issue.
And using my dietitian lens here, thinking about from the standpoint of the nutrients that food provides, if someone is quitting smoking and their bodies either haven't been getting these nutrients because maybe they're under eating when they're smoking due to the appetite suppressant effects. Is that correct? That there can be an appetite suppressant with
There
smoking?
can be, yeah. Some people use it that way.
Mm-hmm. If they start eating and they're choosing foods that are more nutrient rich, can that help the process, in terms of almost repairing their body that had been exposed to smoke for however many years?
Well, smoke's a big oxidant stress, and it's one of the reasons that we see, so much of the change, not only in the lungs and the skin, et cetera, but and interestingly, people tried to give antioxidants to smokers, and it actually didn't turn out to be helpful at all. You can't give yourself vitamins to work out of the impact of smoking. So it's still just, you got to quit smoking. But yeah, it's conceivable that we've been deprived of adequate antioxidants and good nutritional support for a period of time, and that your body's sort of craving those.
Yeah, interesting.
One thing that I always like to think about this is that, I think women fixate a lot on weight gain. We all do it. We're all part of the same social culture that fixates on the size of a woman's body. But really, it's not about the weight of a woman in menopause. It's about the fitness of a woman in menopause. And once you quit smoking, you're so much more likely to be able to be healthy and fit and
Mhm.
feel good when out exercising, that I think the overall gain is tremendous.
Yeah, no, that's a great point of being able to and especially with that lung capacity improving, quitting smoking, going for a walk or a run, might feel that much better, even the couple of days after smoking, it sounds like. Excellent. And, thinking again from other lifestyle behaviors, adding in that exercise piece, I've seen that be something that can help people where they're, okay, now if I have that urge to smoke, I usually go outside to do that. So instead of going outside to smoke, I'm going to go outside and take a walk. I'm going to do something active. I'm going to do something that is taxing my body in a different way, but can also be some of that cognitive behavioral switch. Is that something that you found effective, Dr. Lipke? These are
Um,
anecdotal things I'm seeing with some
Yeah,
people.
actually, well, but that sort of tickled my brain. One of the same conversations that I have with people is to say, what is it that you like about smoking? So for a lot of
Mm,
women in particular, what they like about smoking is being able to go outside by themselves and take a few deep breaths. And
yeah.
so I frequently sort of point out, you could do that without a cigarette. Like you could make that time for yourself, that you could step out of your own home, close
Hmm.
the door, and just hang out outside for 10 minutes and have some peace and quiet and breathe by yourself on the porch without the cigarette. And I think so. I think replacement of behavior is really helpful,
Hmm.
and just even talking through some of these strategies of what might be appealing. But it's funny how common that is when I ask, like, is it just going outside and being by yourself? And most of them are like, oh yeah, that's really what I need. It's just that time by myself outside to smell fresh air, and it's a lot fresher if there's not cigarette smoke around you, and take some deep breaths and sort of stare off into the whatever your backyard.
Yeah.
And I think a lot of people also use it as a break from work.
Yeah.
When you're
Mm-hmm.
at work and you have regular cigarette breaks, it gives you a regular break. But there's no reason you can't take a regular break without a cigarette.
Yeah. And that's
Just don't
something,
go for the donut.
yeah, exactly. That's something too. I find with a lot of women during menopause, they need space. They need some space and time, but they often have time giving. Often have trouble giving themselves permission to do that, especially if they're working or especially. So it sounds like the smoking was permission to do this. I have this habit, and now it's reversing that and just giving yourself permission because you deserve a break. You deserve a deep breath. That can be a healthy habit to have.
Mm-hmm.
Yeah. Well, with thinking about different types of strategies, coming back to the social support thing, especially right now where people might not have as much, we're in isolation. Any recommendations? You said that there's some online communities, obviously, if you have family at home, but it may be difficult if your family are also smokers. Anything that you're recommending right now to people, Dr. Lipke, to get that social support in other areas?
Well, I mean, people have been great about adopting to Zoom incredibly fast.
Hmm.
So that's been fabulous. The online communities are really helpful. And then the other thing, there are some studies about doing video visits with a provider. So, and that's really helpful. In fact, it's probably more helpful than phone calls. So for whatever reason, seeing somebody face to face to whom you're accountable or feel, sort of generate this accountability about making a plan, setting a quit date, et cetera, and moving forward on that. And that's all really tenable right now with the outbreak. So I'm actually hoping that one of the things that will come out of this is the ability for us to be more proactive about doing video visits with patients for smoking cessation specifically.
Hmm.
Um, and certainly it's more feasible now, right? We've all gotten better at using video chat, and there are providers available, and that does open up the scope or remove some of the limitations about driving and social restrictions, et cetera, that are sometimes our excuses for avoiding going in to talk to somebody face to face. It's pretty easy to go to your computer if you have one, or to use your phone and check in with somebody once a week about your smoking plan and how your week has gone.
Yeah.
And
That's
that's
I like.
something, yeah, I was going to say that's something we're happy to do with patients at Genève. You can check in with the physicians, or at least talk about your quit plan with the physicians ahead of time, then check in with the health coaches every
Mhm.
week or as often as you need to.
Yeah, I like what you just said about the plan. Being able to have give someone a plan, like this is what this might look like. Sounds like that's also helpful, so that there's a roadmap. There might be some bumps in the road, there might be some other things that come up that need to be navigated, but at least there's a plan in place that working with someone like you or a doctor can initially put that in place, and then they can find support to carry it out, it sounds like. Excellent.
Absolutely. And we're also lucky because like Dr. Lipke says, so many of our primary care providers and pulmonologists are now online and much more using online facilities so much more easily. So it's so easy to find a doctor who will chat with you via video, whether a local doctor, your doctor, our doctor, doesn't matter, just chat with them.
And what about when the relaxation effects of smoking? Some people are saying, they need to take a deep breath, or they need to go outside and have that time and space alone. When I'm working with clients on relaxation, decreasing anxiety, typically it's some type of mindfulness, meditation type of practice. Do those types of things also work when it comes to quitting smoking or supporting people when they've quit?
Yeah, well, so there are multiple layers to that, right? So one is the behavioral component of taking the time and going out and taking some deep breaths, and certainly we could replace that with mindfulness practices. There are really clear pharmacologic effects or neurochemical effects of nicotine, and so that's where adding in sometimes for people who are addicted, and most people do have some component of the actual drug addiction, replacing that or offering some pharmacologic support can be really useful. So most of the time a combination strategy is most helpful, and again, there's sort of variable levels of behavioral input, but for women, behavioral modification is a lot more important, or behavioral support is a lot more important. But some of that relaxation is because of the drug impact, right? So, and again, smokers are really adept at changing the way that they inhale smoke to give themselves different types of effects, which is really fascinating, right? That you can use the same drug, smoke it in a different way, and sometimes be stimulated and sometimes be relaxed, and sometimes, so it's really fascinating. But it's one of the reasons that nicotine is such a hard drug to quit, because you can use it in this really multifaceted way. And we probably don't, when you're a smoker, you probably don't really think about that until you start conceiving of quitting smoking. And even the idea of quitting smoking causes a lot of anxiety for most people, because there's this sort of, it's a big life change, right? It changes to some extent their self-identity and what their social network looks like, because frequently they have a lot of smokers in their lives, or they may have certain smokers that are important to them and they feel like they're going to lose that connection with people. And so support through that and reassurance can be really useful. But back to your question, yes, mindfulness can be really helpful in terms of trying to get through those moments when resisting a cigarette is really difficult.
I know one of the techniques that I've often heard is just, whenever you think you want a cigarette, take 10 deep breaths.
Mm-hmm.
Stop, take 10 deep breaths, see how much you really need it at the end of those 10 deep breaths.
Mm-hmm. Yeah, it might help to turn down the volume a little bit on that craving, that you can get over it just enough. How long, what's the range of time it might take someone to quit, and what variables might play into that? I know that could vary on individuals.
Well, people do it in different ways, right? So some people try to sort of cut down and quit smoking so that the nicotine symptoms are less. To be honest, there's no right way to do it. I think it's probably more successful just to sort of jump in the pool, because there is no amount of safe smoking, right? So any amount of exposure to this will continue to perpetuate the risks that we have. And so, and I almost think that the sort of tapering effect can sort of prolong the anxiety, the expectation of quitting smoking. If it's the best you can do, great. I mean, that's all, we want you eventually to quit smoking, right? But, and so however you're going to do it is great. But if people, ask my true opinion about it, I think you should just jump in. Just, pick a date, set a date for yourself, put it in your calendar. It's a couple weeks out, figure out the strategy that you're going to use, figure out the reasons you're going to quit smoking, whether those are health reasons or financial reasons or for your family or whatever they are. Write them down so you can see them and remember them, get some of these tools ready, and then just sort of jump in.
Excellent. And that made me think of motivation to keep going. What are some tips that you have when, you set this date, you do it? I would imagine initially it's like, okay, I'm doing this. There might be a little bit more, it's new, that you're focused on. Okay, now you're 3 or 4 weeks in, it's getting harder, or there's temptations. What are some ways to avoid that or or work through it?
Well, so I think the first week is the worst, right? So once you make it through that, then first of all, like congratulating yourself for making it through a week of no smoking, because you're really through the nicotine component, right? The nicotine's out of your system in a couple of days. And I mean, within an hour or two, some of the effects start to dwindle, but the nicotine fully is out of your system at about 72 hours. And so you're done with that component. And each week gets easier, right? So the first week is terrible because a lot of your mechanisms for coping with your stress are difficult, and especially again, I'm self-referencing here, but I mean, my plan was not great. It was like, I'm just going to quit, and that there was no other plan except for that, and I ended up crying on the sofa, but I made it, So, but each week gets easier. But then the thing you have to remember, and I think that it's really important to point this out. You're never done with the addiction, really. You get more adept at coping with it, but there's no time at which you're going to be able to have a cigarette again and not have the drive to sort of go back to it. So sometimes people will stop for a period of time and then they'll pick it up again. And I always feel so bad for them because there's never a moment that you can start again and just smoke a little bit. It will ramp right back up to where you were before, because those, those coping mechanisms or those coping strategies have been well ingrained into your head. And then there's the sort of, biochemical reinforcement of it. So once you're done, you've got to sort of promise yourself to be done. If you fall off the bus, then you just get back on, right? But don't do it intentionally to think that you're able to you've beaten it, right?
Yeah, I think that's a good point to clarify. There really isn't any safe amount of smoking. And if you are someone that smoked for years, the impact is powerful, and it is going to be hard, but there's all these resources to help you.
Yeah, it's totally worth doing. It's just, we all know it. Everyone knows it's going to be hard. It's why people don't do it every day, right? But it's a surmountable hurdle. It's
Yeah.
just, you just have to have the right tool set and be prepared that it's going to be a little bit of an internal battle.
Mm-hmm.
Dr. Dunsmore, Sue, one question that I thought of, because we get questions a lot about HRT. What is HRT and smoking for women in menopause? Do they mix? Do they not? How does that go?
Well, that's a good question. So for many years, we said no, women who are smokers are not good candidates for HRT. The reason being is that we know that smoking has significant cardiovascular effects, and we know that hormone replacement therapy can have significant cardiovascular effects depending on how it started and who it started in. Most of the cardiovascular effects related to hormone replacement therapy sort of become more of an issue when you're 5 to 10 years out from your menopause before you start that hormone replacement therapy, because a lot of them are related to changes in your vascular system as well as blood clotting. Whereas the smoking cardiovascular effects are slightly different. So in more recent years, the recommendation has been softened so that smoking itself is not a contraindication to hormone replacement therapy, nor is, nor is like high blood pressure, things like that. Those things can go hand in hand. And in fact, there are some studies that show that the benefits of hormone replacement therapy on cholesterol and cardiovascular markers that we see for women hold true even for smokers. So in some ways, you're sort of balancing, well, could this be helpful as well as perhaps harmful? That being said, if you're smoking and you have higher cardiovascular risk and you have high blood pressure, and then you're looking at hormone replacement therapy, you're just adding little layers of risk all the way along the way. Mm-hmm. So you really want to think about, well, which of these risks are worth it for me, and which ones can I modify and take away so that I can live a healthier lifestyle? And so I always, when I'm starting a conversation about hormone replacement therapy for someone who's very symptomatic and who is a smoker, I say, the most important thing you can do, both for minimizing your symptoms, because smoking does impact menopausal symptoms, and for your long-term health, is to quit smoking. And that's more important even than starting hormone replacement therapy.
Great point there. Well, with this topic, it's hard to do, but it's possible, and there's resources to do that. Dr. Littke, if our listeners want online resources. You mentioned some. Any others that we can include in our follow-up that would be helpful for online or even maybe books or things, resources that you recommend?
Um, I I wish I had that off the top of my head. I know that there's one for the American Lung Association has good resources online. It's funny because I have all these sort of pamphlets and things that I talk about.
Right.
I do want to just clarify that I feel like such a negative person that I'm like, oh, it's really hard. There's no person that can't quit smoking, right? Everybody can do it. It just some people, it takes more tries, right? So the average person takes 5 tries. That means that many people do it the first time. There's a lot of people who it takes 10 attempts, right? So, so if you have failed or you want to try and you sort of blow it and end up back smoking, there's no period of time where you just you should put in your head, you should never put in your head that you just can't do it. It's totally possible. It's just hard. And we are able to do hard things. We all do them. And it's one of those ones that you have to sort of account for all of the benefits that you will reap from this amount of effort. And so it's really important to sort of remember all of those health benefits that are gender specific, but also, with regard to our cardiovascular health and our pulmonary health and our, overall our skin health, et cetera. I mean, a number of things that are important to many of us. And so I encourage people to do that. I think one other thing that I would like to point out is that if you're struggling with mental health issues, so if you have untreated depression, if you have untreated anxiety, it's really important to try to get some support for those. And I actually prefer that people do that before they make their first attempt at quitting smoking. Because many smoking, can be one of the ways that we support ourselves through anxiety and depression and sort of treat that ourselves. And so if you have that well treated with good support from either your primary care doctor or a psychiatrist or a psychologist, et cetera, there's a number of mental health professionals that could support you through this. I really think it's important to get those things treated as well as possible before you try. So not to add things to your to-do list, but that's an important reason that people can have trouble and stumble.
A good reminder to set yourself up for success when you're going to do this and not give up. It's hard, but you can do it. And
Yes.
and the multiple tries are going to have more benefit than not quitting at all.
Absolutely. Yeah.
I was going to say the American Lung Association has great online resources. The American Cancer Society also has some great online resources for quitting. There are lots of quitting groups. I remember back in the 80s when my parents were quitting, they joined something called Smoke Enders, which I think has gone online, which is sort of a support group, but I think they still exist. They're out there.
Yeah.
And everybody just has to find the one that sort of fits with their style.
Right. I'm a little embarrassed that you know that better than I do, Rebecca. I've got a whole bunch of pamphlets in my office.
We're all in this together. We can.
Thank you for that.
Yeah. One of the things that you just said about quitting, so I think I know the answer to this, but I'm going to ask Dr. Dunsmore Sue. In terms of menopause, if someone's already gone through menopause, they're still smoking, and they're like, I've gone through menopause, my heart disease risk has already increased. Why is it any benefit to me to stop smoking? What would be that additional benefit?
Because you can always reduce your future heart disease risk. You can always reduce your risk of COPD or chronic lung disease. You can always reduce your risk of lung cancer and other cancers. And, it's every day, month, year that you are a non-smoker makes you healthier for the future. And, there's, like Dr. Lipke said before, there is no time where it is too late to quit smoking and get some benefit from it.
Well, I thank you both for your time. Do you have any last closing thoughts? I think that was a good, there's no time like the present to quit smoking if you're a smoker is my takeaway.
Yeah, I think my closing thought is always there's no time like the present, but also if you fail, just try again. You will succeed at some point. And, every smoker who tries to quit will fail 1 or 2 times and then they will succeed. You just got to get back on that horse.
Yeah. I think the message that is to be kind to yourself, right? A lot of smokers have a lot of shame about their smoking, and don't want to talk to their doctors about it because they're ashamed that they do it, and it's something that people feel really separated from their doctors about. This is a place where your doctor wants to help you, and there are a number of other resources that want to help you do this. But be kind to yourself. Lots of people have been addicted to this. Lots of people have gotten through the addiction to it. And congratulations for considering it even, and looking into the steps that you would take to be successful.
And Dr. Lipke, if any of our listeners want to work with you or your clinic, how would they get in contact with the clinic that you're a part of?
Yeah, so I'm on line. So my name is, if you just Google me, I'm there at Swedish, and yeah, we have a number of great pulmonologists there, and I'm there, and happy to help and advise people in any way that I can be useful.
And
So online, at Swedish Medical Group.
Google. And Dr. Dunsmore-Sue, if any of our listeners want to work with you, you or any of our telehealth providers with Gennev, how would they go about doing that?
They just go, hey, again, online, and hit, telemedicine. We're right there. And we have providers in 48 states plus Washington, D.C. now. So we're almost to complete country coverage.
We're getting there.
We're getting there.
Yes.
We're so close. But we definitely have health coach coverage in all 50 states.
Yes,
so
we do.
If you want the support for quitting smoking and the accountability, definitely sign up for Health Fix and work with our health coaches like Stacy.
Yeah, yes, and that's another thing, related to the accountability and the support around smoking, but also improving those other habits that can support your health at a time when you might need something else to focus on. So exercise, nutrition, stress management, sleep, those are things that our health coaches can help with. So thank you very much for your time and for this recording, and in honor of a National Non-Smoking Day coming up here on May 31st.
Thanks for having me.
Thank you.